that help in development of polio vaccine. So the introduction of polio vaccine.
We'll get into that.
Yes.
Okay, so you said that it attacks the central and peripheral.
There are different kinds of poliomyelitis, and there are different types of polio virus. So where we have some like wild polio virus, type 1 wild, type 2 wild. But what we'll now talk about in the course of this discussion, for the sake of polio and the paralytic polio, there are people that will have polio, but they won't.
The people who will have polio and not be paralyzed, how will you know that they have polio?
Okay, yes. One is most of them, the suspicion that they have this, and maybe you test them, you take their stool, maybe you have an outbreak in an environment, and you whatever their blood and check for the virus, and you are seeing they have polio, but they are not having symptoms. Most of them will just have something like they just present. Now you may see an adult with such have this kind moving, have the virus moving, but they are not presenting with symptoms. So
Okay.
Now this non-paralytic polio,
the lifespan of the polio is short.
Short. I mean, when in the first day and the 10 days or 2 weeks, the symptom has
no permanent damage.
No built over time. They have no predisposing factor to make them go down with the disease. Now when we have another ones develop the paralysis, listening that for those that have paralytic, usually it in the brain stem, call it the loss of reflexes, also become stiff. They cannot extend limbs. Their limbs will be so weak. If you stand a child, that child will not be able to stand. So those days that put in a floppy limb, they cannot stand. That when paralyzed will be able to.
Very important topic, because a lot of people are ignorant about the effects of polio and how they can prevent. My name is Lillian. We have told us what polio is, how it presents, told us that it shows in different factors.
Okay, dominant or common in children, like Middle East, like current people with low income people are exposed to the virus, because due to the mode of getting this virus, poor sewage disposal, in Africa, those individuals who are not able to afford a class A life or class B life are more exposed. The poor people, these are the predisposed young children with diabetes, those with HIV, those with cancers are at risk of having polio in the past, but due to our immunity, the policeman of the body, we're able to fight it. And most time viral infection that common disease, so polio as a virus, immunity plays in Africa, it's something that have to do with illiteracy, because you see individuals who are illiterate and not able to afford, so their literacy level is higher than our own. So literacy, who cannot afford good meal are at risk of having polio. If a child has kwashiorkor polio, you cannot go to United Kingdom, you cannot go to place like have money.
Brings me to the things to stop polio.
Okay. Yes. So
in the
environment, they don't dispose their just as the nervous system and attach from one place to the other.
Yes.
So those places that currents are not able to move.
This is so nice, and that was thinking things. I'm sure a lot of people venture into somewhere like that, and
definitely viral, strong element poison, like lead poison. I think we've talked about lead poison here too. You could inhale lead poison from that. Yes. Oof. So, and that's why we talk about Africa. Go to US, for instance. However, there are poor places in the US, but the majority of the places, about over 90% of the places are still good. So you can't go to those places and see how sewage. Somebody cannot dig a soak away and channel it to an endemic problem, malaria and rest of them.
Okay, earlier you started telling us about how it can be.
I heard you talk about vaccine, when the mites, one of the myths about is the disease that live. So one of the ways that you can actually actually stop it by vaccination. So kids are vaccinated at birth. We have two kinds of vaccine: oral polio vaccine and IPV. That's OPV and the IPV. The one they give at the oral, the one they inject. So mostly giving OPV given at 0 at birth, at 6 weeks. I mean to say they're giving an IPV given at 2 months, 4 months, 6 months, and 6 years. So this is the commonest way to prevent this, because when we are discussing this, we have to discuss based on our own peculiarity. Immunization that a child must have. So polio is an immunizable disease.
Before you go on the prevention, in fact, that all polio vaccines have side effects, and that's why a lot of people are anti-vax.
Which is wrong. It's almost all vaccines have side effects, but to me, most of these vaccines, that's why most of them are just fever. When the child comes, give vaccine, the child goes home, has fever and all that. So most of them
side effects of vaccines. I don't know whether it was you that said even this paracetamol you take has side effects. Of course, if you read all the side effects,
you won't take it.
So why now?
Why something that will prevent you from? So these are myths, as you've said, as a result of poverty literacy. Because majority of our population are not educated. They don't even read. They don't even know what the vaccine. That vaccine is all about the benefits. So when they just hear one thing, they'll propagate it.
That's it.
So every vaccine has side effects, but the benefit of all polio vaccines outweighs the demerit. So I don't like vomit when you go home.
Because if you say side effects, it sounds like a huge deal.
Yes, when you get home, just by as you're leaving the clinic, so that the mother will not even experience it. So I know that the food we eat, the water we drink is satisfied, but in this environment, how many can afford it? How many persons can?
Even this thing I told you about open defecation, people are selling by those.
Yes, side of the also I'm here to cook and do so many things. So hygiene is one of the most important way. So I've talked about the good drinking water, like the ministry will be, so that this sewage will be properly managed. So I must call government.
Please do.
Because our government is not doing enough. I must be honest with you. They are not doing that.
I mean that there is people who are taking that anti-fertilizers or polio vaccine.
And false have carried. Don't blame the people.
Ask myself. Go to Baba that did it for me, did it for me. Now another one says that polio vaccine can overload your immune system.
That's false. It can only immunize against polio. If you get a polio vaccine, it can properly vaccinate and completely vaccinate. About what she said, the child has developed immunity. And do you know how introduction? If she is able, nothing is not possible. Nothing is not possible. But there is absolutely
of the opinionated.
There is absolutely
of the opinionated.
They go. They say, I went to child.